Safety around sports, particularly youth sports, it's always a concern. In the past year, there have been several examples of some scary situations on the field or on the court where medical professionals and first responders help to save lives. We're going to talk about why having trained professionals around sports and various sports is so important. And we're going to do that with a doctor of nursing practice, and he's also a sports fan who is affiliated with the Brooklyn Skyhawks youth football team. I've known this man for decades. We are both proud Brooklynites and alums of Clara Barton High School. We used to hoop together at Barton. Introducing Dr. Julius Johnson. What's up, man? How you doing?
What's going on, brother? I'm doing good. I'm blessed. How you feeling?
I'm doing well, man. I'm glad to have you here. Barton is in the building, man.
Absolutely.
Who would have thought this would happen? Barton's in the building. Really excited about this. And I wanted to talk to you about a lot of stuff with sports and medicine today, particularly around football, youth football. So we're going to get into this because you played youth football with the Brooklyn Skyhawks. You're still heavily involved with them. And recently you did a CPR simulation program where you were showing people around the team how to use CPR training and why that's so important. So I'm gonna ask you, you know why it's important, but for the viewers watching, why is CPR training so important for coaches and players and parents to be involved in that? Why is that so important?
It's important because we all watched what happened with Damar Hamlin on national television. And as I started digging into the research to try to prepare our organization for it, started realizing, picking up a bunch of things, right? And realizing what sudden cardiac arrest is, how common it is in young athletes, but also more importantly, the importance of having an actual protocol to do that. It's one thing to certify people in CPR, but having a protocol of, you gotta get this defibrillator on them within 2 minutes. Can you actually practice getting off this jersey and their shoulder pads and their t-shirt and doing that in under 2 minutes while also placing the AED pads. And I think simulation prepares us for real life because it's nothing like having experience, so we want to make it as close as possible.
Make that close as possible so people can see if they're in that situation, why it's so important, because minutes, seconds can save lives, as we know. And so recently we've seen situations with some young athletes. We even saw a young man, Caleb White, stand out in Alabama. He suffered a medical emergency in which he tragically passed away after collapsing on the court. And it's a really sad thing. In this country, do you think most high school teams, because we're talking about youth football, youth sports, do most high school teams have the professionals in place to deal with medical emergencies? Do they have that? Is that something we need more of?
So here's the thing. It goes state by state, but let's take New York State, for example.
Okay.
In New York State, every high school team is mandated to train their coaches in CPR, but they're not mandated to have a defibrillator on standby, which you would need. So that's school-wise. You run into, so that's a problem in discrepancy of having available defibrillators and actually knowing the protocols of how to place it, when to place it, and to listen to it. Then you talk about recreational sports where the majority of athletes actually play, like they play recreational sports, especially until you get to the high school level. It is not mandated anywhere in recreational sports in New York State, nor do most teams have the funds to actually get certified in CPR, let alone actually buy a defibrillator, right? So when you're looking at this problem and how complex it is, where most of our children play at, and we want them to play safely because it's not just football, it's across all sports. So we wanted to be able to create something that you can do in recreational leagues.
Yeah, it's something that needs to happen. I want to follow up on that real quick. How close do you think we are to seeing that happen where we have defibrillators available for recreational sports? Because if we're thinking about the safety of kids, how close do you think something like that is to actually happening? I see you're part of that change, but how close do you think we are to seeing something like that implemented?
Ooh, honestly,
yeah,
not close.
So we have work to do.
A lot of work to do, right? Because it's important that people know CPR. It's important that you do simulation to decrease hesitancy, but it's also important that you give people the tools. It's like training somebody to be a medical doctor, nurse practitioner, physician assistant, nurse, right? But then telling them I'm not going to give you the actual tools, stethoscope, needles to actually do the training.
Right. Now you got to have the tools if you want to be effective, and we're talking about safety in the situation, which is so important. So you talked about cardiac arrest, and that's been a term that has been out in sports, unfortunately, with health safety. We saw Damar Hamlin. We talked about his near-death experience on the field earlier this year. Then we saw Bronny James recently, the son of LeBron James. He had cardiac arrest while practicing with UNC. I think when people hear about this, JJ, they say, okay, someone's had cardiac arrest. what are the chances that they can continue to play the sport that they love? What are the chances these young men and women can continue to play that? Can young men and women who have suffered cardiac arrest, can they continue to play the sport that they love in the way that they want?
So I think it's important to understand what type of cardiac arrest we're talking about. When you talk about older adults having cardiac arrest, there's usually some sort of heart failure that goes along with it, which means that your heart may not recuperate to the full extent. When you talk about what happens in young athletes, we're talking about something called sudden cardiac arrest, right? Or in Damar Hamlin's stance, a specific subsection of sudden cardiac arrest, which is commotio cordis. Those are really, so your heart is a rhythm, right? And like we call it loved up, right? Like every time it beats, and we all feel our heartbeat, right? And what happens is that if something interrupts that rhythm, right, and you go from this to like a wiggly line, you need something to make you go back on rhythm, right? And I say all of that to say, if we can correct that rhythm, then it is possible that, yes, you can go back and play sports again afterwards, because it was just a rhythm correction that we really don't know why it happens, right? Like there's no explanation of why somebody has a sudden cardiac arrest versus the other 1,000 kids that play that doesn't have it, right? So if you can correct that rhythm and then make sure that you follow up with your cardiologist and your specialist and they say everything's all right, you can go back to those activities.
Right, and this is what I think people are concerned about, because when you see things like Damar Hamlin, Bronny James, those things seem very scary. And it is scary because sudden cardiac arrest, as you just mentioned, that's the leading cause of death among young athletes. So 2 things here, and you might have touched upon this a little bit before. What causes sudden cardiac arrest, and is it preventable? That's something I think a lot of people watching sports want to know. Is this actually preventable?
So we really don't know what causes sudden cardiac arrest from a standpoint of, let me figure this out and then prevent it, right? It's one of those things that it's sudden, it happens. For some people, meaning in commotio cordis with Damar Hamlin, you take a strike to the chest and it disrupts your heart rhythm, and then we try to correct that with a defibrillator, right? For some people, you may not ever take a strike to the chest. You may just suddenly just fall down. And you don't know why, because there'll be a bunch of people doing the same exact activities or more physical exertion, and they may fall down as well.
All right, that's something that happens. So it's just so different. And as our viewers can see, timing is so important in terms of, as we talked about before, just being able to react to that. We saw that in the case of Damar Hamlin. Timing was everything in that situation. Absolutely. And we hope that is done to keep athletes safe. That brings me to the last thing I want to talk about here, JJ, because you're a sports fan too. I know you're a big sports fan. We always played sports growing up. As a sports fan and as a medical professional, as a doctor, what do you think societally around sports we need to improve in the future when it comes to keeping athletes safe? Is it more education? Is it more training? Is it more access to that for people? What do you think we as a society need to do to help keep athletes safe in the future?
So I think the education is important, but I think we need to have our trusted professionals taking place and being in front of the community and giving them advice. Because people, especially in our communities, they trust the people delivering the message more than they actually trust the message in most cases, right? So for us, when we created this program, one of the first things I did was talk to the Brooklyn Skyhawks, who they trust me. I played for them for 6 years. I've been coaching for them now for 10 years. We have a relationship. I went and got people that I trust, Greater New York City Black Nursing Association. We started that organization in 2017. We're a very large chapter. We do a bunch of different work. I also use NYU School of Nursing. I work there. I'm an associate professor. We come together and say, hey, let's create this protocol because we don't want to just teach CPR. Let's make a protocol that other people can take, borrow, use, switch, improve upon. And then we implement it. So now when we go implement this in front of the coaches, I have nurses that run all of their hospital codes, right? Meaning every time somebody's heart stops, the nurse that's in charge, one of those nurses is there. I have vice presidents of institutions, chief nursing officers. They're all there helping, right? Along with the CPR instructors, along with football coaches that are being trained. So now what it does is that our kids are looking and going, hey, can we get certified? Our parents are now demanding that we come back and say, we want to get certified. Other schools are contacting us saying, hey, can you bring the Black Nursing Association over here to do that? I want to do it. I want people to have buy-in, and we trust y'all to create this educational program for us.
A part of you saying that is you have created that trust by actually doing the work that needs to be done in this situation. And another thing and why we had JJ have this conversation is that it's so important for people like you that trust you and what you do, and the Black Nursing Association in New York, what you guys are doing there is just so valuable, man. Thank you. I'm glad we had this conversation. We have to have more conversations around sports and medicine and how it all works together and safety. You're doing a great job, my brother. Happy to have you here, my man.
I appreciate you.
I'm really happy to have you here. That is Julius Johnson, doctor, doing a lot of great work around youth sports and medicine. Check him out. Check out his work. Julius, appreciate you coming up. We got to do it again, brother. Thank you so much.
Anytime. Thank you.
Barton was in the building.